my advice to the patients is to let it heal. If there's no innervation, there can be no exercise, because there isn't any neural conduction. So if there's no signal getting through to the muscles from the brain, no matter how many times you try or how hard you try to move those muscles, they will not move. When a patient tries to move their face in a very efforted way, what they're really doing is they're increasing the asymmetry by hyperactivating the unaffected side. And so they're actually decreasing their symmetry even more, strengthening the unaffected side, and habitually learning some bad patterns. I use analogies with the patients, because every single patient that we see after the diagnosis of Bell's palsy or paralysis after acoustic or whatever, they're going to go home and they're going to just try to crank that thing and to move it as much as they can. And so I will use analogies with them. And I think that these are really helpful for the patients to teach them what they're dealing with, because they look at it as a muscle weakness as opposed to lack of conduction. So what I'll tell them is, it's kind of like if you have a lamp on your table and you unplug the lamp, how many times will you have to flip the switch for the bulb to go on? And so that gets their brain thinking in a slightly different way, that, oh, yeah, it can't possibly work right now. That nerve is going to take X number of weeks or months to heal. Another analogy that I'll use with some people is if they've broken their leg, for example, and it's in a cast, what kind of exercises are they doing to strengthen their leg muscles or to strengthen the bone? And of course, they're not doing any exercises. They're allowing that to heal. And so speaking in analogies, I think, helps the patients kind of calm down. And with Bell's palsy, for example, given the fact that 80 to 85% recover completely and spontaneously within 3 months, they have a time frame where they're just letting it heal and letting it rest. We begin retraining actual retraining when tone increases or there are small movements evident.